Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about what happens specifically if you're a general dentist or a pediatric dentist and a patient comes in that's not your patient with braces on and they ask you to remove them. So let's talk about the steps on what to do, what paperwork you might need, what records and documentation you might need, and how to keep yourself out of hot water if you choose to take this case or this patient. So I would say this usually comes into a couple different buckets, and you kind of want to try to figure out the true story and exactly what the patient wants before you commit to taking this. If and it's a completely different story if in your practice, specifically if you're like a general dentist and this is your hygiene patient, this is your regular patient, as opposed to some just random patient that walks in off the street and they're having their ortho done someplace else and they're just telling you, I'm over this, I want to discontinue this, I want to take these off. So this is your regular patient. I'm going to probably treat it slightly different than I would if it was just a walk-in off the street. But regardless, you still have to have the right documentation, everything signed. And I always want you to defer to your own Dental Practice Act in your own state or country of licensure. There may be specific guidelines for this that are different than the guidelines I'm used to. So I want you to always be familiar with that. So take a look at that first. The other thing you should really look into is talking to your liability insurance company. No, you're not getting in trouble for this, but always good to bounce this scenario off them because sometimes they also have a specific way they want this dealt with just to keep you out of trouble. So now I've got you all nervous. So let me tell you what the trouble is. Okay, keep in mind that this patient has opened a contract with another provider somewhere and for whatever reason has decided, which would include that contract, the removal of braces. So I always say first thing, have you thought about going back? Who did your braces? Obviously, have you thought about going back to Dr. So-and-so to have your braces removed? Because it's probably included. I hate to charge you for something, you've already paid for it basically, or you're already paying somebody to do this. So I always start there because sometimes they think because they walked into your office, you're just going to take them off for free. So always good to just clarify that. Certainly patient has moved to a different state, never going back to that other state. Okay. I understand, okay? That's a completely different scenario than it's the guy down the street. And sometimes I don't really want to get entangled with the guy down the street because it might cause trouble. So try to find out the true story first. Second thing, so that was the first bucket, patient has moved. Okay, I get that. If you don't know anything about orthodontics at all, this is where you may want to pause. And I often have doctors consult with me on this because let's look at the bite. Let's look at the way the bite is. Let's make sure that we're not in an unstable position. So let's say, for example, I'm going to give you a scenario. Patient had crowning and we're maybe like 50% done. And now we have kind of a funky bite on some anterior tooth where it's kind of like an unstable bite and not all the teeth are contacting. And it's a bite that if I took the braces off, it might cause damage, in this position. So I'm always going to say, if we stop the treatment now, you're kind of in an intermediate spot or an unstable spot. I don't know if I feel that comfortable stopping your treatment, agreeing to stop your treatment for you. So, how about either, go consult another orthodontist, get another opinion. If you can't give the opinion as to the risks, benefits, and alternatives of stopping at this position orthodontically, you should not be taking off the braces. So this is what I'm trying to get at. Now, then again, every patient that's over 18 has a right to make their own decisions. If they want to stop treatment for whatever reason, they're more than welcome to stop it. So of course, I'm also playing that scenario too. So again, be familiar with your Dental Practice Act. I realize I'm like literally playing devil's advocate here, but it's a little more complicated than you think. I need you to understand all the scenarios and what you're getting yourself into if you take a part in this debond, okay? Because now you're part of this process. If anything was to go wrong, you're going to get pulled into it. Because if you didn't explain the patient's risk, benefits, and alternatives and say, hey, maybe you should continue, here's why, before you just agree to take it off, you could be liable. That's what I'm getting at, okay? So don't just rush to be the hero because the patient wants you to. And sometimes patients are on a whim. They're like, I want these off, and they're not even thinking clearly. So, whoa, hey, let's back up. So, ultimately, what was the reason? Why are they changing providers to get them off? Most of the time, if it's not the I moved to another state thing, which I understand, okay? Um, but for the most part, when you move, the other provider arranges treatment for you to go someplace else. So, again, it's usually you're not abandoned, it's because you chose to leave the doctor. The other issue that's most common with braces is that this patient didn't pay their bill, had an issue, had a beef with the previous provider, and it's just leaving because they're getting themselves in hot water and they don't want to deal coming in because they have to pay their bills. So that's the most common reason someone asks you to take them off. Now, ultimately, again, that's fine as long as I explain the risk benefits and alternatives. Of course, they are going to pay a fee for me to take the braces off, okay? They're also going to sign a discontinuance paperwork up front, okay, saying that they're giving me full authorization. I do have an early Debond request form. It is in my documents store, which is on my website. If you go to StraightSmileSolutions.com, click on store, you will see the document library. And these are free documents for any of our VIP or concierge members. Get unlimited documents from us. If you're not one of our members, you can go ahead and purchase one through our store. But in any case, we do have documents for that. It's called the early Debond form. You can modify it if it's an Invisalign case, just change out a few words. But this form should protect you. Again, though, you might be able to get that form for free from your liability insurance company, so feel free to contact them if you don't want to pay us for it. But in any case, yes, of course, the first thing you do is you have them agree, you sign the form. Other thing you're going to want to look at is, again, does this patient need retention? Do they need retainers? This is a whole different story if they need it. How do you know if they need retainers? Well, again, you don't know, because unless you know where they started, which you're not going to know because you don't have a copy of the initial records, you're not going to know if they need retention. I mean, obviously, if it looks completely straight, class 1, great bite, of course they're going to want to get retention. I would never take off someone's braces if it looked really good without retainers. Sorry. I just in good conscience can't do that. So the question is, what services are we offering here? Because whatever services we're offering is what we are going to bill for, right? So one of the services we might be offering is just the removal of the braces. Now, it's never just removal of the braces. It's also going to be a set of records. So you're going to bill for removal of braces and final records. Actually, I take an initial and a final record. I take a set of photos before I take the braces off to capture where we are. And then I take a set of photos after the braces are off. As well as a PANO, because that's standard, final record, standard of care. So you're billing for that. What should you bill for that? Well, again, it depends on, are we offering retention? Are we going to be delivering retention? Are we going to be delivering retainer appointments? What are we offering? What are we going to do? So you and the patient need to figure out what exactly you're going to be doing and what exactly they're expecting of you. Also, anytime you're offering retention and final records, I mean, this is basically like you're finishing up the case. So it's going to be a much bigger fee than if you're just taking them off. So I know I'm totally clouding your brain here because there's so many different options. So sit down with the patient, figure out what they want, let them know what your fee is going to be. Once you figure out what they want, explain the risk, benefits, and alternatives to all the options. You guys have an agreement. They sign the discontinuance early Debond form. You go ahead and snap a set of pictures before you pop the brackets off. You pop the brackets off, clean the glue. Then you take your final records, which is a whole nother set of photos and a PANO. And then if needed, you're going to deliver retainers. And then if needed, you'll be also offering retainer checks. What should you charge for that? Well, ultimately, again, this depends if this is a random patient walking off the street, or if this is going to be, or this already is your existing patient in your general dental office that, you're just taking care of. So I would say for the removal of the braces is also going to depend on what type of braces it is. If it's just regular metal braces, those are super easy to pop off. Is it going to be, if it's these kind of ceramic braces, I'm probably going to charge more. So removal of brackets, my standard fee, just brackets, I'm talking about no retention, no retainer visits. Removal of braces with final records only. I would say my standard fee, if I was a general dentist and this was my hygiene patient, I'd probably charge $200. If I was a general dentist and this was never my hygiene patient, I would probably charge $400 to $500. If this was okay, and now we're getting into the whole, I'm also delivering retainers. If you're delivering retainers, you're also doing retainer checks. So, because anytime you do, then it's going to be more like, depends on what type of retainers. What are they asking for? somewhere in the neighborhood of $1,000. And a lot of times when this happens, the patients are like, screw this, I'm going to go back to my old doctor because I already paid for it. That's totally fine. You know, sometimes they just go, oh, it's the same price as a trip back home. So again, that's kind of what I would do. Those are the steps I would take. A lot of times people change their mind or decide not to do it. But, you know, I take my time, and they can shop around. They can always find someone. They always will find someone cheaper to do it who won't charge all those fees. So, you know, cash only kind of stuff. There's always some dentist that will do it. So, you know what? Keep your standard of care. Do things the right way. Make sure you explain all the risk benefits and alternatives. Capture all your records, of course, and get that signature. Those are the main things I want to tell you. All right. Thanks so much.